It's been a week of jaw-dropping statistics, I have to say, here at the World Bank IMF spring meetings. How about this one? 4.5 billion people globally lack access to essential health care. Monique Vledder runs the global health practice at World Bank. That seems unbelievable. It's more than half the world's population. Explain that to us.
Yeah. Well, so people need health services in different moments in their lives. And so we're looking at, are people able to access services when they need it? And those people, half of the world population, as you're saying, cannot access services when their children have diarrhea or when they need a vaccination, when they are pregnant and they need to be tested for certain diseases, etc. And so we share your concern. We have this very large group, but in addition, we have 2 billion people that have to make very tough choices between using their money for buying access to health services, so paying for health services, or putting food on the table for their families. And so it is really, a really complex and challenging situation.
We're not just talking about the developing world, right? I mean, obviously, people lack access to healthcare or a way to pay for healthcare in the United States and many countries that don't have universal access, right?
Yeah, that's right. Yeah. And so we saw that during the COVID pandemic, maybe a good example, right, to build on the huge loss in lives and really the inability of the health system to fully address the needs of people, right? And so at the World Bank, we work with countries to support them to make these investments that are necessary in the health system, but also to put the issue of healthcare and investment in healthcare and on the top of the agenda of governments, right? And so, unfortunately, after the pandemic, we see a decline of investments in health from governments, but also from donors, and we are concerned about that, as we think that investing in health, it's an investment, and people look at it as an expense, right? It's not an expense; it's an investment, and so really advocating around more funding for health and ensuring that health systems are ready to deal with whatever shock, whether it's the next pandemic or it's fragility and conflict or it is climate.
Before the next pandemic comes along, we're barely out of the previous pandemic, the COVID pandemic. Were there any lessons learned at all, and what have been your sort of takeaways from the past couple of years?
Yeah, and so lesson number one is that the frontline health services in many countries were not ready to respond effectively. And so these are primary healthcare services, laboratories that can test for diseases, the surge that you need in health workers. And so we overall see that health systems in many of the countries were not able to respond effectively. And so that was the first lesson. And second, really big challenge is that over time that requires consistent and sustainable financing from government resources and also from partners. And we have this unfortunate sort of cycle of panic and neglect, right? And we really need to look at that. We have learned much more medium to long-term areas where we need to support countries to be better prepared.
Do you worry about the political environment globally, but certainly within the United States, and how it could impact the funding that you need moving forward? For example, if a Trump presidency meant a significant defunding of the World Bank?
So I cannot comment on what a Trump presidency would mean, so first of all, it starts with the priority and the support, and this is also the conversation we're having around the spring meetings from ministers of finance, seeing the importance of investing in health from domestic budget. And so that's one very clear area of focus. And then at the World Bank, we want to do better and more in terms of our own investments in health, but also work very closely with others so that we can look for opportunities to innovations, like for example in digital health, to really leapfrog and have better impact even with existing resources. And so for us, it's sort of that three-way, with the government priority around health and investing in health, our own stepping up, right? Our own contribution we can make at the World Bank with our financing, with our learning, and then also through the partnerships that we form, that also, including with the private sector, that helps us to mainstream and scale up innovations that just create better impact with the funding that we have.
And that notion of taking vision and idea and putting them into action has been talked about quite a bit this week. I know World Bank has a pretty big announcement to make about this very issue.
Yeah, that's right. We are really excited that given the importance of this issue, we are announcing that we're planning to reach, with our financing and our programs, 1.5 billion people over the next 5 years with quality health services. We will do that through a three-pronged approach. One is increasing the geographical coverage of the scope of our programs, including making sure that we target those people that are most in need. We will expand the services that are being provided through primary healthcare services to include other type of diseases beyond maternal and child health care, like long-term non-communicable chronic diseases like hypertension and diabetes, which is very rapidly increasing also in low-income countries. And we will work to lower the financial barriers for people to access services, really making sure that people don't have to make that difficult trade-off between using their money to access a quality health service or to buying food or clothes or education fees for their children.
And so does that involve actually supporting the establishment of better quality care centers in some of these locations? Are you going to literally fund the building of clinics? What is the work specifically?
Yeah, and so we sort of use three different tools, right, for our programs. One is the financing. And based on the country leadership and based on the specific country needs, we can invest in service delivery. So and that can include expanding clinics, but it's oftentimes very much about making sure that the health workers are trained, that the supplies are available, that we have people, community health workers in the community, mobilizing people to access services, to do preventive care, etc. So it's a wide range of activities that we support. And then we also, alongside, support governments to look at health financing reforms to make sure that over time the health sector is funded through pooled funding and government funding and not out of pocket by individuals.
Okay, well, Monique Vledder, thanks for sharing that announcement with GZERO. I appreciate you being here.
Thank you so much, Tony. It was nice to meet you.